Moral Reconation Therapy, or MRT, has been utilized as an offender treatment program since 1986. MRT materials are used in 9 countries and in all 50 states and U.S. territories. Thousands of programs offer MRT in drug courts, prisons, jails, parole and probation, substance abuse treatment programs, in schools, colleges, with veterans, and in many other venues, including domestic violence treatment. Over 200 outcome studies have been published on MRT programs, and all but a few of these studies have shown that MRT significantly reduces recidivism, decreases substance use and abuse, reduces disciplinary infractions, increases program participation and completion, enhances life purpose, increases moral reasoning, and leads to a host of other beneficial results. Because of overwhelming peer-reviewed evidence, MRT has been recognized as an evidence-based treatment by SAMHSA and numerous other state and local governments and agencies. As an evidence-based approach, MRT programming requires fidelity to ensure that the treatment can be replicated and applied to various populations in a consistent manner. Thus, specific training is required for treatment personnel who use the MRT materials. Training is conducted both online as well as in limited venues allowing for in-person training. MRT training is conducted by certified MRT trainers and consists of 32 hours of contact. CEUs are available for treatment professionals. MRT is a workbook-based cognitive behavioral approach that is conducted on a step-by-step basis where participants prepare homework and present their work to the other group members either in an online format or preferably in a small group meeting. There are very specific rules and procedures used for each programmatic step, with these procedures a focal point of MRT training. In general, the groups are conducted on a weekly or twice-weekly basis, and it takes participants 12 to 32 meetings to complete the program. The groups are open-ended, meaning that new participants can enter an ongoing group at any time. Basic MRT training is typically focused on the adult version of the workbook entitled How to Escape Your Prison. Treatment professionals who treat juveniles are also trained to use the juvenile MRT version of How to Escape Your Prison, which has been revised to enhance its effectiveness. Once an individual has been trained in basic MRT, various other MRT-based workbooks can be utilized by their facility. In addition to the adult and juvenile version of How to Escape Your Prison, there are variations of the workbooks designed to focus on specific populations and needs. Filling the Inner Void is designed for both adult educational groups as well as for dedicated substance abuse programs treating both in- and outpatients. Discovering Life and Liberty is employed primarily with adolescents, within schools and juvenile programs, churches, and also in welfare to work programs. There is also a specialized MRT workbook used in veterans courts and in VA facilities entitled Winning the Invisible War. In addition, a specialized MRT program for domestic violence perpetrators entitled Bringing Peace to Relationships is available. However, because of licensure regulations, it requires a specialized training. For more information on MRT, click the link below.